My name is Bernard Chiira. I'm the CEO and founder of AT4D, and I'm joined by my good friend and partner who will introduce himself. And today we are here to have a chat about artificial intelligence on the continent of Africa, and we are at the Inclusive Africa Conference. So, Chris, please introduce yourself and tell us a little bit about, why we're here.
So, thanks, Bernard. My name's Chris Harrison. I'm the co-founder of NextStep Foundation. We are focused on leveraging technology to improve the lives of persons with disability and lead them to economic independence through digital skills training and job placement.
All right. So, at AT4D, we also focus on people with disabilities and assistive tech. And, while we are in the innovation space, we find a lot that all these activities are working towards one goal, and that's the empowerment of people with disabilities. Now, I think in the context of artificial intelligence, it's moving so fast, first of all. And there's a lot happening globally in terms of breakthroughs in assistive technology, no, in artificial intelligence. But the big question, or what I like to call the elephant in the room, is are people with disabilities getting involved and moving along with this? And I think that's what we are here to talk about, but within the context of a very interesting study that we are doing. So tell us a little bit about this study and from your perspective, why it's so important that it's happening now.
Sure. So, as you said, NextStep Foundation, AT4D, and Rail and Professor Capoño were asked by IRDC and FCDO to do a scoping study of how artificial intelligence can impact the lives of persons with disabilities in Africa. Obviously, assistive technology is one key area where AI can and is having an impact. In fact, the conversation that happened immediately before ours about Signverse, which is a Kenyan startup, which I believe came through your incubator.
Yeah.
And they're using artificial intelligence to create digital avatars for the deaf community. So there's been quite a bit of research around how AI can impact assistive technology. One of the things I think that's unique about the research that we're engaged in is to try and open the aperture a little bit wider and look at how artificial intelligence might impact persons with disabilities outside the context of assistive tech, right? So if you think about the needs of persons with disability, it's not simply assistive technology, right? For example, NextStep Foundation, one of the areas that we're very focused on is mental health. The stigma and marginalization that comes with disability, particularly in the African context, can often lead to mental health issues for persons with disabilities. And so are there ways in which artificial intelligence, particularly generative AI, can be leveraged to provide mental health support? Again, as the prior conversation about, the lack of sign language interpreters as a driver towards leveraging artificial intelligence to fill that gap, there's also a lack of mental health professionals in Africa. And so can leverage generative AI to fill that gap as well? But when we talk about mental health needs, it's not simply the person with a disability, right? That person is part of a larger community. I'm thinking in particular of caregivers, right? So are there ways that artificial intelligence can help caregivers, whether it's through their own mental health or simply providing answers and information for how best to facilitate the lives of the persons with disability under their care?
Yeah, so obviously, there are many assumptions about what disability is and how people with disabilities interact with technology. And I think one of the interesting things about this study, the scoping study that we're doing, is that we really want to know what's happening. Because from where I sit, I've been leading innovation for assistive technology for a while now, more than 5 years. And there's a lot that is already happening in the innovation space where entrepreneurs are actually already using AI to build solutions for persons with disabilities and with persons with disabilities. But I think this study might be an eye opener because we are first of all looking at three countries, right? Kenya, Rwanda, and Ghana. And rightly, you say that this is not just about looking at it from the lens of assistive technology, is because AI is literally changing the way we live, the way we work, the way we do everything at a much faster pace. And I think this is where things get really interesting. We've had a few engagements around this conversation in different contexts. One of the things AT4D was involved in a little bit later last year is actually to test a generative AI application that was being developed by a university in Finland. It's called the YAMK University of Science and Technology. And this was to look at generative AI in the context of rehabilitation services. So just like in mental health, we find that persons with disabilities consume a lot of other services. And in that space, then, one of the interesting things we found out is that people are already asking ChatGPT about these issues, but we have, I guess, a lot of challenges with um, data sets, and this is what again was referred to in the previous conversations. So, in your view, I mean, what are some of the challenges we are seeing when it comes to building solutions or making it easier for persons with disabilities to use AI? Do you think it's entirely a data gap issue? And also to remember that in AI is not a homogeneous thing. We have different types of models of AI. Generative AI is a popular one, chat-based, conversational. But now we also have, reasoning models. Um, Companies are also looking at artificial general intelligence. So there's a lot. So yeah, tell us a little bit about that. Like, where do you see, where are we going with that?
So you raise, I think, really several interconnected issues, right? We think about maybe four main categories or pillars that we're looking at in the study. So there's governance, there's data, there's talent, and there's compute. And I think the first two are really connected. So the countries that you mentioned that are the focus of the study, Kenya, Rwanda, and Ghana all have national AI policies. But those policies don't specifically address the needs of persons with disability. And one of the key areas where that is lacking is around data. So if anybody's asked a generative AI, so a text-to-image generator, if anybody's asked one to create an image and just say, make me an image of someone with a disability, 9 times out of 10, maybe 99 times out of 100, the image that gets created is a person in a wheelchair. One of the reasons that generative models produce that image is because those are the images on which the model's been trained, right? It's all these models do is make predictions. And so if all of the images in their data are of persons with disability are in wheelchairs, then they predict, well, that's what we should, that's the output that should be created. And so I think there's a real opportunity that we can expand on in our study to help inform policymakers around the importance of making sure that the data sets, the data on which these models are built, is inclusive of all categories of persons with disability. And that really requires intention from the beginning, because creating these data sets is time consuming, it's expensive, and if you don't do it right the first time, right, then you're going to have to live with the bias and the lack of disability inclusion in those models' results. And so as we look at this, the landscape, I think the issue of lack of representation in data is well known. Hopefully what we can do in this study is start pointing towards some potential solutions so that the models that get built tomorrow and the day after and the day after are more representative of the disability community.
Absolutely. I mean, it goes back to the idea of meaningful participation of people with disabilities, even in addressing some of the gaps that we are seeing. But there's also a funding component or issue around all this. I mean, it takes money and resources to, whether it's building data sets or making compute accessible or training people. And I know this study will be getting into that as well. Um, but just shifting gears a little bit, um, most of the time when something is a hot topic and it's kind of like a buzzword and everyone is getting on it, a lot of the times people with disabilities are almost like the last ones to kind of hop on. And one of the things that really gets me excited about this study is that when you look at the whole spectrum of what's happening in AI in Africa, I don't think this time we are late. I think we are, right where we're supposed to be. And I want us to speak a little bit about how people can get involved in this study, and how long is this study for, and it's going to be across 3 countries. So who are the type of respondents we are looking to get engaged? I know it's a conversation that involves literally everybody, but we have identified a few interest groups. So could you speak a little bit to that?
Sure, we're talking across really the entire ecosystem. So that includes policymakers, that includes for-profit companies who are either building assistive technologies or just in the field of artificial intelligence in general. We are talking with NGOs and funders about their priorities and where they see opportunities, universities and researchers on, again, assistive tech specifically, as well as artificial intelligence in general, assistive technology companies that you can bring to the table. So I'm hoping that on the screen we've got the QR code,
Yeah.
To a survey that we created that is really designed to help us understand what the needs of persons with disabilities are, and then from that find ways in which artificial intelligence and Gen AI might be able to address those needs. So the more people that we can get to participate in our study, give us that information, the more fulsome our research can be, and the more solutions we can identify.
No, absolutely. So I hope our QR code is up, and if you're interested in being part of this kind of scoping study and would want to participate, we'll be running some surveys as well as focus group discussions across 3 countries in Africa. Please scan it, and you will get directed to a link where you could leave your details, and we will surely get in touch. So, Chris, as we wrap up, um, I think we're living in exciting times because of the advancements in technology that we have. And yourself and myself have been working in the disability sector, for a couple of years now. And we really want this to be a moment that we don't miss, because there's been many moments in history where the disability community has missed the moment and totally gotten left behind. And whether that's on digital accessibility and many other aspects of disability rights, what, in your opinion, do you think is you know the only way to ensure that the AI revolution carries on persons with disabilities, and how can they also be not just like passive consumers of AI, but they get involved in themselves, whether that's in the building of AI or leveraging on AI for entrepreneurship, for employment, and talk about this within the context of what we are doing at the Center for AI, which is a partnership I'm really proud of.
So I think the disability inclusion issue is really almost a subset of the broader issue, right? Where does Africa get left behind, this fourth industrial revolution? And, as you say, unfortunately, disability inclusion is often an afterthought. It is something that people realize after the fact, oh, maybe we should have thought about this from the beginning. And so hopefully part of this scoping study surfaces this issue in a way that policymakers, Gen AI developers can take notice and make sure that disability inclusion is intentional and designed from the beginning, and that that means including with persons with disabilities in all of those processes, whether it's in the policymaking process, in the application development. I think for persons with disability, it's really you need to start using these tools, right? As you were talking about using ChatGPT, almost all of these platforms have free versions. And it's really about getting on and trying them out and having conversations and learning how to use. I think there's also an opportunity for those of us, whether it's in the training space or in the entrepreneurial space, to help people understand how to use these tools effectively. Because the old garbage in, garbage out metaphor also applies in how you use Gen AI. And so the more sophisticated you are in asking questions and understanding how to prompt those systems, the better the results are going to be. And I guess lastly, I would just say what's really exciting is how the cost of development has declined. I was speaking with someone the other day, Jacaranda Health, who developed a maternal health application, was talking about, the cost of developing their first model only about 18 months ago was in the hundreds of thousands of dollars. And today they think they could do it for the tens of thousands of dollars. We're building apps now for $5,000, to get a prototype out the door. And so I think there's a real opportunity for entrepreneurs that have ideas to start just building new applications on top of these foundation models. And that includes persons with disabilities. If they can identify solutions, the opportunities to create them are more widely available today than they've ever been. And the power of the technology is really exciting.
Absolutely. I guess we got to wrap up, and this is all the time that we have. But as we wrap up, it's such an honor to engage on this conversation at the Inclusive Africa Conference happening in Nairobi. And the theme of this year, of course, is accessibility, innovation, and entrepreneurship. And we are really excited to be leading research that's going to help us uncover how we should move on. So it's been a pleasure having this conversation. And please, let's keep it going. I hope you've scanned that QR code, and that next year when we come back here, Chris, maybe we'll have something to present to our audience and inform everybody about what's happening on the continent. And I'm really excited about it. Thank you so much for this conversation.
Thank you, Bernard.
Thank you.